If you have neck or shoulder pain, it may be coming from forward head posture. Stay tuned and I'll show you how to improve it with one exercise. Hey, welcome back to Uplift PT. I'm Dr. Joey Luo, physical therapist, and today we're talking about forward head posture. So why is this such a serious issue and why are there so many videos out there trying to fix this? Well, when the neck is pulled forward, it creates an imbalance in the neck musculature. And what that can cause is stiffness, pain, even headaches. And I know a lot of people try to stretch it out, they try massages, they even try the multitude of exercises out there on YouTube. But there's only one thing that's really gonna create a long-lasting change, and that's learning how to use your deep neck flexors. So let me show you. The deep neck flexors are a group of muscles in the front of your neck, right in the center. Now there's a lot of research that shows improving the strength of these muscles can reduce neck pain. I got a great article for you, click the link in the description to check it out. So, why do they call them the deep neck flexors? Well, they're neck flexors, which means they help you do this motion, bringing your chin to your chest. And they're deep, which means they're far away from the surface of the skin. They're actually so deep that they're attached to the front of your spinal column, right on the bone. That's good because it gives them a short lever arm for stabilizing each vertebra. Let me give you an example. If I hold a heavy object really close to my body, like this, I can hold it for a long time, I don't have to expend a lot of energy. Versus if I have a long lever arm and I hold it all the way out here, I have to use a lot more energy to hold on to the same object. The deep neck flexors are close to the bone, so they don't have to work hard to stabilize. Here's the plan. I'm gonna first show you how to activate the deep neck flexors. Then I'll show you how to incorporate that into other neck posture exercises. Let's get going. Before we start, shout out to Dr. Justin Lin at Rehab and Revive Physical Therapy for inspiring this technique. All right, here we go. Press your tongue to the roof of your mouth. That's gonna activate the deep neck flexors. Now, when you do that, you wanna make sure you press the whole tongue to the roof, not just the tip of the tongue. And try this. In order to really feel the activation, what you can do is you can pulse the tongue a couple times on the roof of your mouth. And you're gonna feel it right under your chin here, and even into the neck a little bit. That's how you activate your deep neck flexors. And you're gonna keep your tongue pressed to the roof of your mouth while you do all of your neck posture exercises. Now let's incorporate this new technique into a very common neck posture exercise, the chin tuck. So here's how you do it. First, you're gonna bring your chin straight back like this. Don't worry about that double chin. There's no shame in doing your exercise properly. Here's from the side. Notice I'm not bringing it down like this. I'm bringing my chin straight back and I'm feeling a little bit of a stretch in the back of my neck here. All right, now press your tongue to the roof of your mouth and you're gonna feel those deep neck flexors activate and tuck your chin. You might get a little bit of a shake. It might feel a little different. If you feel these side muscles activate, those are your SCM muscles, and they shouldn't be on while you tuck your chin. If you do feel them, tuck a little bit less. You may be going past your limit. The SCM muscles are really meant for breathing, rotating your head, and also side bending. They're not meant for stability, so they shouldn't be on while you do your chin tuck. So you can give it a hold, or you can do reps, whatever you prefer. As long as you're feeling the muscles activate in the center and you're keeping your tongue on the roof of your mouth the entire time, throughout the whole exercise. Great, so whenever you're trying to work on your forward head posture, use this technique. It can be applied to any exercise that you want to do. To recap, press your tongue on the roof of your mouth. That's going to help to activate the deep neck flexors. So whenever you do a neck posture exercise, apply this technique. Tongue on the roof of your mouth, feel the deep neck flexors right in the center, nothing on the sides. So, if you found this video helpful, hit that like button and let me know in the comment section. This is the first video in a series on neck and shoulder pain. So if you're interested in that, please subscribe and hit that bell so you don't miss out. New videos come out every Saturday. I'm Dr. Joey Luo, physical therapist from Uplift PT. Thank you for watching the video and get moving.